All right, guys, in this video, I'm gonna show you the anterior hip exercise. This is gonna hit the psoas. It's gonna hit the anterior aspect of your joint capsule. And it's also gonna strengthen the glutes, the hip flexors, and lengthen the rotators as well. So the key with all these exercises is when we get into these different ranges of motion is to strengthen the muscles all around them, is to mobilize the joint capsule, take care of any kind of restrictions, whether it be calcium deposits or osteochondrites or anything like that in the joint that is limiting our flexibility, okay? So with this exercise, what you want to do, set up a band about knee height there, and it doesn't have to be super strong, but it's got to exert a bit of a pull on you. Can't just be a really, really light band, all right? So you're going to set up in this lunge stretch here. The front leg, the knee's at about 90 degrees, and this hip should be in extension here. So that's the angle right there, hip extension, okay? So we start off, everything's lined up nice and straight, good posture, nice and tall. And then from this position, I want to go from a flexed hip. This is how I start. Squeeze the butt, and then I drive forward into that hip extension with the glute contraction the whole time. And what that does is it teaches the glute to take us into this hip extension position as opposed to just passively letting gravity and the weight of our body push us down into this position, okay? So here, when I'm in this position, I want to squeeze the glutes as tight as I can for 5 seconds. So I'm squeezing them, focusing, really focusing. The front foot, ball of the foot stays planted in the ground the whole time. Knee is abducted out there, okay? But the front foot stays planted. Got my 5-second squeeze on, good posture, breathing, and then I relax, okay? Posture is important, chin tucked, shoulder blades pinched. From here, relax for about 5 to 10 seconds to get that stretch. And then I'm scissoring my legs. So I'm pulling my knee on the ground. It's not actually moving, but I'm pulling it forward to activate the psoas, the hip flexors here. When that happens, it co-activates the opposite leg, the glute. This is the contract relax technique. And we're strengthening the psoas in this end range of motion here, okay? So in 5 seconds, contract. I got to really focus and breathe. Keep the posture. These are all important techniques that you've got to do. From here, I relax, down, and get that stretch for another 10 seconds. So we're lengthening and we're strengthening all at the same time in this one technique. This band here is pulling the femur. So the femur is the thigh bone. It's pulling it forward so that the joint capsule in the front is getting mobilized and stretched, okay? Because that can often be a restriction. It's one of the 3D flexibility factors, okay? So when I'm done that, back off, and all I do is I turn my foot out. So I internally rotate my femur like that. It doesn't have to be full, but just kick it out a little bit. And we're gonna do the same thing. Now the front foot, you wanna do the same, just a little bit, less than what you did with the trailing leg. Okay, so you turn it in a little bit, same thing. You start, glute squeeze, go forward, keeping the glutes on. Posture, trying to squeeze this butt as hard as I can. Now it's a lot tougher when you're internally rotated here. The glute's a lot weaker there, but that's why we're developing that strength, so that it can move and it can stabilize us in and out of this range of motion. So 5 seconds. It's hard for me to breathe when I'm talking. And then relax down for 10. And this is all active stuff. It's work. It's not just sitting around passively stretching, okay? Now, same thing. I'm gonna scissor. Keep really tall. Scissoring my feet together, my knee and my front foot together. Activating the psoas here. Right in here, you should feel this muscle fire up. 5 seconds. And relax down to get that stretch, okay? Hold that stretch for about 10, okay? We'll back it off here. And then obviously you would repeat with the other leg. All right? So that stretch, that's taking the psoas stretch up another level. Not just stretching the psoas passively anymore. We're strengthening the psoas, the glutes in that end range of motion in hip extension, and we're getting the band assistance to mobilize that joint capsule. Okay? Breathing helps us to let go of the neuromuscular tension and to avoid the tonic muscle response that we get from these tight muscles, especially the psoas. It's a very tonic muscle. It takes over because it's tightened up. We're sitting all the time. It's shortened, becomes tonic, and it's hard to let that go. Okay. The other thing that we're doing, make sure when you get in and out of the range of motion, you are going slowly. You're not rushing and like jamming your body into that range of motion, because if you do that, the stretch reflex is going to fire up, and it's going to limit your ability to get the stretch and get the lengthening that we want to happen. All right? Now, an advanced technique that you can use, and this is if you're flexible enough in the rec fem, in one of the quad muscles here, is at the end, after you've done those two sequences there, you stay in that position, grab the knee, and grab the ankle, pull the heel to the butt. Then you get up tall. And what I like to do is grab both hands on, and this is in the straight position, so you'd reset. Both hands on, shoulder blades pinched. Every time I inhale, I think of lengthening my spine, getting up tall. Every time I exhale, relax. And what we can do in this position is squeeze the glute, 5 seconds, and then relax, get that heel closer to the butt, and then kick the ankle into the hands. And that's going to activate the quads, 5 seconds, and relax. Okay? So this is only if you have the flexibility for it. It's an advanced technique. If you can't quite get the flexibility, work your way up to it. All right? So that is the exercise for the psoas, lengthening and strengthening, and getting that flexibility into hip extension.